Thank you for the question. You are right and you are wrong. CMV has been one of the main pathogens in stem cell transplant, but recent developments both in early diagnosis and prevention of CMV has made it less of a problem. But certainly each transplant center doing allogeneic transplants need to have a management strategy for CMV, and the most common one today would be to give antiviral prophylaxis with a drug called letermovir. If that is given properly, the risk for significant CMV infection has become much less in recent years. Yeah, as I presented at the meeting, it's the third version of the guidelines, and each of them provide up-to-date management recommendations for transplant centers. ECIL means European Conference Infection and Leukemia, and EBMT is one integral part of that organization. So we had a working group reviewing literature published since the last version in 2017. And went through a number of different topics, including diagnosis, monitoring of infections, but also very significantly and importantly CMV prophylaxis with letermovir. The new things that is happening is that in the United States and in Europe, letermovir is now available and licensed for treatment in children, or in Europe it will be at least in a couple of weeks. And that is a big change because until now it has been off-label for children. We are also introducing new treatments for resistant refractory CMV with a drug called maribavir that is also receiving a strong recommendation. And finally, we are adding for the first time some CMV guidelines for CAR T-cell treated patients and patients treated with bispecific antibodies. It's not my primary area of expertise, but I think the key message is that, as with both bacteria, in some instances with viruses as well, the antimicrobial resistance is becoming a big problem also in fungal infections. The likelihood that you will find resistant fungi is increasing. The climate change changes the growth particularities of fungi, so you will see new fungi in areas where they have not been present before, and all these things are likely to pose challenges over the forthcoming decades. Well, for example, the ECIL guidelines that we just talked about, there will be several different publications in, for example, Lancet Infectious Diseases, Lancet Hematology and Leukemia. So these are European targeted guidelines, but of course also clinical infectious diseases and blood, for example, are also very important for our field.